Linda Hayhurst, an Australian, is another patient who needs cosmetic surgery. Due to dental problems that have caused her face to droop, Linda opts for fat grafting instead of a facelift. Her surgery is very delicate and she suffers an allergy due to anesthetics. If not properly handled, this surgery could be fatal.
The whole thing is a very, very serious thing. You know, you're playing with your life and your face and everything else. I don't think a lot of people don't. They go into it thinking it's just going to be a joke. You know, I'm going to come out looking fantastic and the rest of my life will be fantastic. And it's not going to work like that. It's from in here. You do it for the right reasons, not the wrong reasons. And don't keep going back.
Linda looks much older than her age. The stress she's had in her personal life has aged her. Her deteriorating dental health condition also added more stress, and she wanted to feel better again.
I knew I wanted to get my teeth done, and I knew with all the weight that I'd lost and the stress and everything in my face, it was starting to show, and I was starting to feel like I didn't want to go out anymore. I just felt really couldn't be bothered putting makeup on, and that's not me. I wanted to get the me back that was caring after other people, and I wanted to feel good again.
Initially, Linda intended to have a facelift like some of her friends. Her surgeon, Dr Yap Lok Huei, advised her against it, as a fat grafting operation was sufficient. Fat from Linda's stomach will be transferred to her face to help restore her face to its original shape.
Friends that look like skeletons or corpses now, because they've got no fat, they've just got skin pulled on bone.
Back in the operation theatre, Dr Yap and his team continue to inject Linda's own fat into her face. This process is very time-consuming and intricate.
For me, I don't look at this as plastic surgery to make myself look beautiful. This is just going to make me come back to what I was before I had a lot of stress, because, you know, I need to move on.
Unlike some women who feel pressured to go under the knife, Linda does not believe in doing so just to satisfy others.
If my boyfriend said to me, "You've got a big nose," I'd say, "See you later." You know, I like my nose. You know, if it was like that, different story. But you would have got something done, or it's a medical thing. It's how you are, your well-being, something like that. It's not a love-hate thing, you know.
Meanwhile, more fat is injected into Linda's face. After sufficient fat is injected into the targeted areas, Dr Yap then stitches up the 4 holes on her face.
I do know personally, I have friends in Australia whose daughters are having breast implants, lifts, tucks, lipo, and they're not even out of like 21, they're still young. They've got a whole life ahead of them to age naturally, and yet they're trying to fix it already. Michael Jackson looked terrible in his lifetime. What are these kids going to look like in 5 or 10 years?
Linda notices the changing trend in today's society. The peer pressure among youngsters has resulted in many of them going under the knife. She herself has never experienced such pressure growing up. After about 2 solid hours, Linda's surgery finally comes to an end. Dr Yap's expression says it all. In a few hours, Linda will wake up to her new face. Dr. Yap pays Linda a visit 6 hours after her surgery. Linda seems to be coping well with the recovery.
Fantastic. I don't feel like I've had surgery. I look like I have, but I don't feel it.
Linda's face appears slightly swollen. In 2 or 3 days' time, the swelling will heal. Her first fat grafting surgery has been a pleasant experience so far.
It wasn't as drastic as I thought. It was cheaper than I thought, but it wasn't a question of money. I wanted to get somebody who knew what they were doing, because you can't get this wrong.
Today, Linda will be reacquainted with her friend from Australia, Sharon Winter. Sharon had a similar surgery as Linda.
I had lipo done on my legs, and that's where they took the fat to put into my face, and possibly that's the only part that's a little bit tender, but my face absolutely not at all.
I had mine out of my stomach, and just a little bit of discomfort, but not painful. Obviously because they've been working there, but it's not.
Only 2 days after the surgery, these two ladies are back to normal, except for their swollen lips.
Who am I?
Give us a kiss.
Who am I?
We'll see if we can
It was Linda who motivated Sharon to have her surgery done in Kuala Lumpur. Sharon has her own reasons why she needed and wanted this surgery.
And that will make me give a nice sense of well-being again, and I'm not
More
getting
natural.
into this really old lady syndrome. Grow old gracefully, nicely, but always enhance yourself as much as you can.
But naturally, without having the dragged corpse look. No?
Both of them have only been in Malaysia less than a week and are leaving soon. This would be Linda's last encounter with Dr. Yap, and he's happy with how well her face is healing.
We're all confident, but you just feel better when you go out and put a bit of makeup on, that you're not trying to hide the wrinkles.
I'm going to put makeup on. I won't have to think, oh, it's all going in the lines.
Yeah.
This is also Sharon's last encounter with Dr. Yap before she flies back tomorrow. Like Linda, her surgery has also turned out well.
Thank you.